All right, let's talk a little bit about how to explain our ConfirmMDx test to a patient. So the biggest first thing I always make sure to explain to everybody is never scare your patient. Don't tell we thought we missed cancer or anything like that. We really want to talk about adjusting that timeline and kind of preparing the patient for what would happen if it comes up negative or positive. So how I would approach it would be, doctor likes to order a confirm after a negative biopsy, just to make sure we can figure out where we want to see you back again. If it comes up positive, that kind of gives us a little alarm bell that maybe something wasn't found the first time, so we just want to follow you up a little closely. We want to make sure that we repeat that PSA again. We want to make sure that we do an MRI if that's something that the provider likes to do. We want to make sure that we repeat that biopsy sooner rather than later, because the last thing we would want to do is, if you had cancer, is to miss it. Prostate cancer is very treatable if we can get to it soon enough. So we want to make sure that we haven't missed it out. And then on the flip side, if it's negative, doctor is going to see you back in 6 months with a PSA like normal. And that just lets us know for the next 2 years that we can feel really confident that we haven't missed anything and that we can just watch you like we normally would. So we're just trying to figure out really how the doctor is going to follow you up for the next 2 years after this biopsy. And it's just going to give us a lot of great information. It's a test that you don't have to come in for. We don't have to stick you. We don't have to do anything. It's going to be run right off your prostate tissue the doctor took already during the biopsy. We'll get it back in a week or two, and then we can all kind of move forward from there. And that's just going to give us a lot more information than we currently have. It's kind of like a double bang for your buck, if you will.